Hello and welcome back. My name is Casey. I am an OBGYN physician, and I have been using this channel to create tips and resources for current and future OBGYN residents. Today I'm going to be sharing with you the 6 top apps that I have on my phone that I have used the most over the course of my 4 years of residency and now as an attending. So if you are a student going into your OBGYN rotation, or if you are currently an OBGYN resident and don't have any of these, then I would highly recommend giving them a download. Some of them are free and some of them you will have to pay for a subscription, but I encourage you to look into the discounts that they offer for students, and also to find out if your residency program will pay for certain subscriptions for the apps that I'm going to mention. So the first one is super obvious. This is just the ACOG app. That stands for the American College of Obstetricians and Gynecologists. On their website, you can access all of the practice bulletins. And if you aren't wanting to open that on a browser, you can have that directly accessible on an app. So you can search the practice bulletins and committee opinions, which are a series of documents that contain clinical content written and peer-reviewed by experts in the field, full spectrum obstetrics and gynecology.
So this is what the app looks like. It's the top row in the middle, and when you open it up, you can see the front page. You can go into the search bar and search any topic essentially, and then it'll pull up the list of all the practice bulletins and committee opinions that are associated with that particular topic, and you can enter in and read them.
The second app I'm sure you have also heard of. It is called UpToDate, and this is basically like the Google/Coles Notes of medical literature. You can search thousands of medical conditions, medications, and just a broad variety of clinical topics that provide evidence-based point-of-care clinical support.
So this icon is in the top left. You can type in the search bar any topic that you are interested in learning about. Once you open a topic, it will give you a summary, epidemiology, clinical manifestations, diagnostic evaluation, treatment, etc. And within the articles, it will give you hyperlinks to associated readings for the topics addressed within each of the UpToDate articles.
The third app is ASCCP, which stands for the American Society for Colposcopy and Cervical Pathology. This contains evidence-based and risk-based management guidelines for pap smears, colposcopy follow-up, and follow-up after excisional procedures. This one is super convenient because you can basically pick the clinical scenario that describes your patient situation. You can put in their age, what their pap smear results were, what their HPV results were, what their prior abnormal pap smear results were, and it'll basically funnel it into the algorithm that will then help you to decide whether or not you need to just follow up with a repeat pap smear versus set them up for a colposcopy versus set them up directly for an excisional procedure.
This one, the icon is middle row on the left. You can pick your patient age range and the clinical scenario, and basically, based off of the findings that you have had from previous testing, continue to press next, and ultimately it will give you the recommendations for the next steps in management.
The fourth app is amazing, and I don't think a lot of people know about it yet because it's relatively new. It is called Open Evidence, and this is amazing. This is like ChatGPT AI for health literature. You can type your clinical questions into the interface just like you would with ChatGPT. And it pulls up all of the medical literature and data with references, but synthesizes the answer to your question in a kind of human format response as if you're talking to a person. When I first downloaded it a couple months ago, I had to put my national provider identifier number in, so you had to actually be a clinical provider in order to have the app, but I don't think that that's required anymore, so students and anybody I think can use it. I would caution you to make sure that you do check the references, but it is a fantastic starting point and great when you're in a pinch or in particularly challenging or unique clinical scenarios, because it can be helpful in finding case studies or specific case reports based off of the topic and the question that you're asking about.
So it's the orange app in the bottom left. As you can see, you enter in your question just like you would in any other GPT model app. It generates an automatic response and it lists the references, which you can click and it'll open in a separate browser. The nice thing is it'll also give you additional question prompts that you can click and it will also answer.
The fifth app is MDCalc. This is an app that has a bunch of medical calculators, scoring systems, and algorithms constructed for you based on clinical research by physicians. This is super handy when you actually need to use all of those random medical equations that you had to learn in medical school for step 1 and step 2 that you're never going to remember as an attending. And they do have a browser version, but it's just handier to have on your phone.
So this is the bottom right app, and you can type in whatever equation you're looking for in the search bar, and it'll pull up the calculator.
Sixth app that I use, I feel like a lot of people also don't know about. It is called ReproTalks, and I use this in place of what I used to use, which was LacMed. And this essentially has condensed summaries on the effects of medications, chemicals, biologics, and physical agents on pregnancy and lactation, as well as development. It's nice because you can pop a certain medication into the search bar and it will pull up a brief but comprehensive summary of the scientific literature about that specific medication relating to, breastfeeding and pregnancy development.
Middle right icon, you type in the medication that you're looking for information about in the search bar, and it will pull up a quick summary in the first paragraph, as well as the data that we have for human pregnancy and lactation with a list of references at the bottom.
That is everything for today's video. I hope that was helpful. If you have any apps that you really recommend to anyone who is watching, please go ahead and leave them in the comments down below. Otherwise, I will see you in next week's video.